I'm John Chelsom, Professor in Health Informatics at City University London and Managing Partner at innovation consultancy 11 Informatics. Our proposal for a disruptive solution is the development of services to support the introduction of open health informatics to the National Health Service in England. The NHS is just emerging from a decade of wasted opportunity in the development of clinical information systems and particularly electronic health records. The National Programme for IT was a centralised approach to information sharing that has failed on a number of levels. This has delayed the introduction of new systems, weakened the commercial supplier base and disheartened many IT professionals in the service. The NHS needs a new approach to clinical IT. Some have called for the use of more open source software, and it's true that open source and open standards can go some way towards providing long-term solutions. But just introducing open source software risks repeating many of the mistakes that have dogged the national programme: lack of involvement of practitioners, protection of the vested interests of product vendors, reliance on large-scale service providers, and overcomplicated solutions to immediate and very practical problems. Open Health Informatics introduces two new dimensions to the open standards open source landscape. Firstly, the use of open interfaces so that every component of a solution can be plugged in and out at will, enabling a best-of-breed approach to open source and eliminating once and for all the product-centric culture that has held back the NHS. Secondly, the use of open development processes, agile development that involves users and other stakeholders at every step of the way. Agile open processes also eliminate the pretense that users know exactly what they want at the start of development, or that the solution provider knows exactly how to deliver it. With the support of the TSB, we can package up reference platforms, toolkits, implementation and support services that will support NHS staff in implementing effective solutions themselves. 11 Informatics will commercialise these packages to create a solution-centred business which will help transform the way in which clinical IT systems are delivered in the NHS.